Can you imagine a Nigeria where medicine is taken the right way? Because right now, many of us don't. We buy drugs over the counter. We mix prescriptions. We stop when we feel better. Not because we are careless, but because it feels easier than going to a clinic or seeing a doctor. For many Nigerians, medicine has become the first response. Going to the chemist, the corner shop, what worked last time, what someone recommended. Medicine becomes the shortcut, not because it's safer, but because it's familiar.
Good afternoon.
Hello, madam.
I've been feeling weak since yesterday. Small fever, headache.
Sounds like malaria.
Yes, that's what I thought too.
Have you taken anything?
No, not yet.
Okay, take this one. Morning and night. You'll be fine.
No test?
It's malaria. Everybody has it these days.
A slight fever, a quick assumption, no test, no confirmation, just a familiar answer to a familiar symptom. In Nigeria, the word chemist means many things. Some are licensed pharmacies run by trained pharmacists. Some are patent medicine vendors allowed to sell only a limited range of basic over-the-counter drugs. And some are simply shops with no proper training, no supervision, and no clear limits. To the public, they all look the same, but they are not. The effects are not always immediate, but they are real. Some drugs, when taken wrongly, do more than hide symptoms. They damage organs. They weaken the body's natural response. They create resistance, so treatment stops working when it is truly needed. Antibiotics taken halfway can make infections harder to treat. Painkillers used repeatedly can damage the liver, the kidneys, and the stomach, quietly. Sexual enhancement drugs used without medical guidance can strain the heart, disrupt blood pressure, and interact dangerously with other medications. Emergency and hormonal pregnancy prevention, when used casually or repeatedly without proper counseling, can disrupt hormonal balance and mask underlying health issues. Steroids and strong combinations taken without guidance can suppress immunity and worsen underlying conditions. What feels like relief can be long-term harm. And by the time proper care is reached, options are fewer, costs are higher, and risks are greater. Medicine is powerful. And when power is used without guidance, it becomes a silent risk. The damage doesn't announce itself. It builds quietly, like a debt the body will have to pay eventually. Illegal drug sellers and unlicensed chemists must be shut down. Selling medicine without training, testing, or accountability is not access, it is risk. But shutting them down alone is not enough. People turn to them because clinics are hard to reach, doctors are hard to see, and guidance feels distant. The real solution is making primary healthcare easy to reach. The nearby clinics and health centers where people can be seen, tested, and guided early, so medicine is used properly, not guessed at. And reducing the quiet risks of self-medication, where drugs are taken without proper testing, proper guidance, or follow-up. And public awareness, so people know where to start, when to escalate, and when medicine alone is not enough. So people can also tell the difference between a licensed pharmacy, a trained pharmacist, and an illegal drug seller. Because to the public, they often look the same, but the risk is not. Can you imagine?